Right. So in the ICU, when someone's on a ventilator, we prone them, and they were proning, somewhere 16 to 18 hours a day, because what they found was the position of the lungs in a reverse Trendelenburg, and I would put them about 20 degrees with the head up. The reverse Trendelenburg is usually around 30 degrees, but we just kind of tried to find what was best for that individual person. And it really depended on what their oxygen levels looked like in supine versus in prone, and then angling the bed and propping appropriately to protect bony areas. But on the regular floors, people were, laying in the hospital beds looking, at the walls and slightly reclined, which was one of the worst positions for COVID because oxygen saturations were low. So conscious proning is with the patient who's alert and oriented and can prone themselves. And we had a lot of difficulties with that with older folks because you get a lot of low back pain, and a lot of folks as they get older do not lay on their stomach. So we had a lot of education going on there with both the patients and the staff. So I ended up doing a lot of in-services with nursing, just teaching people how to instruct the patients. And what we advised was for them to do as close to prone as possible, or to just kind of find that sweet spot with the oxygen. If they're laying on their back and the oxygenation was 84%, for instance, you roll over onto your stomach with the head of the bed, the whole bed angled, not just the head, the entire bed angled, and then maybe they would reach, 88 or 90. But if you turn to one side or the other, some people had, better oxygenation on the right or the left side, depending on, comfort levels and anatomy, really.